Can you tell us a little bit about your medical journey and what made you decide to set up your own private practice?
Yes, actually, I have been working as a consultant for a long time now, whereas I was working solely in the NHS. And I realized that in oncology, in the field of oncology, things are changing so much. When some effective drug is made available, we know it is very effective in cancer care. We have to wait quite a bit of time in order to get that approved by the NICE in order to use it for the patients. Whereas in the private sector, we don't have to do that because you can use it once MHRA approval is there. And when we know that it is quite effective, we can offer it to the patients who can be seen there, which is a good advantage for the patients. And also it is very exciting to see that that can be offered to the patients in the private sector. So that's the reason I decided that I should get involved with that as well, so that the patients who can be treated there can be given that advantage.
What were the first practical steps that you had to take in order to set up your private medical practice?
In order to set up my private practice, I had to show as to where I'm coming from and what experience I have. And I have been involved with quite a lot of clinical trials, and I have been working as a consultant for many years now, and I have got that expertise. And I had to get some references from the head of service and the head of the chief medical officer of the trust. With all that in place, I got registered in the private practice.
Yeah. Awesome. And then I guess I want to ask you about relationships between like private patients and NHS patients. So how does the relationship, do you think, differ between like NHS patients and private patients? And how do you notice that on a day-to-day basis?
I think when it comes to a patient, I tend to treat them equally. Although when it comes to private sector, some patient will have some expectations where they might expect things to happen a bit quicker for them, which is quite reasonable, and which is something I can provide as well, because although I like to do the same in the NHS setting, there are certain limitations. For instance, if I want to get a CT scan done for a patient fairly quickly and have a look at it to see if cancer is progressing or something like that, I'm not able to do that kind of. There are certain restrictions within which I have to wait for some time. At least, for instance, if we take an urgent CT scan that needs to be done and reported, still it takes about 2 to 3 weeks. Whereas in the private sector, if I make that request, it might be available maybe the following day, which is amazing. Those advantages are there, and I can manage to meet the patient expectations because of that, which is rewarding to me as well as to the patient.
100%. And I guess what was like the biggest mindset shift that you had? So like what was the biggest mindset shift that you had from moving from clinical to running like essentially, a small business, right? With a private practice?
I think in my mind, I think it is rewarding to as kind of to offer that extra advantages that I can offer to a patient in the private sector. So it will give me some freedom to offer that quicker and also effectively. And that freedom as a private company, where I can have some influence to do those things quickly and also offer those services in a more effective way. So that gives me a bit more freedom compared to the NHS.
What marketing or visibility strategies have worked for you so far to attract private patients, especially for, complex cancer treatment?
I think one thing is probably the hospital, kind of getting registered in the hospital and having my name in the hospital as a consultant working for that hospital. Whereas some patients were seeking second opinion and they wanted to get second opinion from me. Otherwise, most of the time, as a medical oncologist, I'm not the first encounter to a patient. Generally, when they come with some symptoms, so the other way of getting the referrals is through the colleagues, where some of the colleagues have inquired. I got to know that you're working in the private sector now. I have got this patient. I will ask her to contact you. So there are some patients being referred that way as well, but still it is in infancy stage, I guess.
And I'm interested to know, like, technology and AI is obviously a huge thing in the medical sector. Are you using or exploring any technology or artificial intelligence as part of your private practice to improve patient engagement or, scalability?
Yes, AI is actually revolutionizing the way we work, and it is quite helpful in many instances. I think we get engaged with it to some extent, but probably I need to explore more in order to get more, I would say, smart, kind of find out more kind of smarter ways of doing things through that. Yeah, that is something very positive that I can see coming up in future.
Yeah. And obviously, now that your private practices begin to grow, what were the main bottlenecks that have appeared over time? Was it time, admin, patient load, staffing? What kind of bottlenecks have appeared?
I think some of the times it would be admin work, but still I have been able to kind of get around them with the help of the secretaries. But when they go on leave, sometimes there can be a bit of a lapse, although there is somebody who would be covering her. She may not be quite familiar with some of the situations. That is one of the lapses. On the whole, I think so far there has been fairly good support from the team where I can actually get things done much quicker compared to the NHS setting where we tend to struggle with.
Over the next 3 to 5 years, how do you see the private oncology practice or private medical practice evolving in the UK?
I think there is a good scope for private medical practice in UK because, especially when it comes to medical oncology, the field of medical oncology is exploding with new drugs and very effective drugs, and also the way we treat. Whereas actually NHS is struggling quite a bit now. For instance, we have to wait quite a bit of time once it is MHRA approved, which means that it can be used in UK since and it has been approved because it is effective and cost effective. It is effective and also it is toxicity levels are acceptable to administer to the patients. Once phase 3 trials have been done, and these have been confirmed, only this would be approved by MHRA. But it involves quite a bit of cost, and it takes a long time for the NICE to approve it because they look at the quality of life as well in addition, and cost effectiveness as well. So some of those effective medications may not be approved because if it may not be cost effective for the years that would be gained by giving that to patients. Those are instances where that can be administered in the private sector, whereas it is not available in NHS setting. I think with the explosion of the new medications into the market, which are effective, there will be lots of advantage for the patients in getting the access to them earlier on in the private sector. So I attended ESMO Congress recently, which is one of the largest conferences held in the world, which was held in Berlin this year, last week. So there was quite a lot of exciting things happening there. And antibody-drug conjugates is the current trend, which has been found to be very effective. What it means is, like, you target the cancer cells with the medication, and that medication goes and finds the cancer cells. And when it is there, and chemotherapy is released, and that destroys the cancer cells there. And also there's something called bystander effect, where surrounding cancer cells also are being killed afterwards. It is like a bomb that is conveyed over to the cancer. So this type of medications that had been quite effective in metastatic setting. Now they have actually tried in preoperative and postoperative setting, and that has shown very extremely effective in treating these cancers. It is not NICE approved yet, and it can take quite a long time for those to be approved. And when they get approval, before they get approval, once MHRA approval is there, we should be able to use that in the private sector to give that extra benefit to the patients. Again, when we do that, there is some question that is coming up. Okay, what will happen if the patients become resistance to these, because these are extremely effective medications, and once the patients develop some resistance, there are not many medications that would be available in order to treat them. So I attended another principal investigative meeting where we are looking at some other potent medication which will be effective in this kind of a situation as well. So I'm going to get involved with that clinical trial as the principal investigator here in my trust in UK to find out other ways of controlling these cancers if that happens. So it is really an exciting time to be in treating cancer in this current setting. They are looking at antibody-drug conjugates as well as immunotherapy together as well, which will be very exciting. And I'm getting involved with some of those clinical trials in gynae cancers as well, in addition to breast cancer. So it is very exciting.
Yeah, agreed. But yeah, awesome, cool. That's all my questions. Thank you for going into detail. I think very educational, insightful. I think other healthcare professionals will find it, honestly very helpful.